Hello and welcome to HCA 522, Introduction to Healthcare and Business Analytics. And I wanted to go through the information that we were going to be talking about last night until I had my issues. Again, I apologize for that. I was traveling and I was going to be doing the presentation from the road, and my computer went four legs up in the air, so I was kind of left with not much to work with. So again, I apologize very much for that. And I'm going to do right now is to go through the information I would have gone through last night. So, um, so I'm going to talk about what the course is, what the assignments are for it. We'll talk about the discussions, the research paper, and the project. We'll talk about the course schedule, and then I'll go a bit into master data management, the data lifecycle, and also data governance. So the summary for the course is data and analytics have become an increasingly important role within any organization, and in so many places now, data is a significant asset for a company or an organization. And the idea behind this course, pardon me, is to give you the foundational knowledge of analytics. We'll cover some of the key components of the analytics process, including strategies of how you can effectively capture and communicate information and the pitfalls in doing so. So the course has three major requirements. There is a group research project, which is 1/3 of your grade. There is an individual research paper, which is 1/3 of your grade. And then the other third of your grade is your online discussions. So this is your group research project. So this is to summarize the problem that you're going to be asked to solve. You've just been hired as the chief data officer at a major hospital system. This hospital system has recently undergone a merger with another network of hospitals in a neighboring state. As a result, you have inherited multiple staffs which use two different electronic medical record systems. You have several different billing systems, both professional and personal. You have three homegrown data warehouses. You have several business intelligence systems to generate reports. You have different processes and procedures, and you have a mess on your hands. And you have some staff in your own area, but other people work across the system, and you have limited authority over them. So in the meantime, your hospital system faces a number of problems. You have poor patient survey ratings. You've had a number of patient safety incidents. You've had a lot of issues with hospital-acquired infections. Your costs are high. Your readmissions are out of control. You're dealing with accreditation audits from both the state and the Joint Commission. And your staff spend endless meetings trying to make sense out of all the data that you have. They're unable to do so. They're dealing with contradictory information. No one trusts what it's saying. And they spend all the time arguing over what the data is trying to tell them, as opposed to actually using the data to solve an actual problem. So your hospital CEO needs you to get a handle on the situation, get a handle on it quickly. So you've been asked to answer several questions. Number one, how do you assess the situation and determine the steps that need to be taken? Number two, how do you get at the data quality issues that the hospital is dealing with? Number three, how do you make analytics a central focus of the organization and ensure that data is regarded as a strategic asset? Number four, how do you get to a combined view of the data and ensure that everyone is getting the same information? And then finally, how do you ensure that the right people are getting the right data in the right place at the right time? So you're going to be divided up into groups of 3 or 4. I expect you to call upon the material in the course along with your own research into best practices in each of these areas. So as a group, you'll get together, you'll do your research, and you put together a 7 to 10 page research paper, which talks about how you would approach these, how you would answer these questions and approach this problem. I also expect you to prepare a presentation deck that would be suitable for 15 to 20 minute executive presentation. So your audience in this case would essentially be the hospital CEO that you've just been hired by. So your analysis and recommendations should integrate theory, research, and any of your other professional research. Should include specific examples and supporting evidence. And any text citations I would expect to be appropriately cited. Please stay on topic and address the course objectives. And with everything, demonstrate popular spelling, grammar, and scholarly tone. This is for all of the work that you submit. And I've just gone through reading all of your discussion submissions for the first week. They're all really quite good in that area, so I'm not expecting any issues there at all. There is at the conclusion of the course on October 22nd, I expect each group to give its presentation. You can, and now how you approach that is entirely up to you. I mentioned this last night. I'll mention it again. This is not a presentations course. So I don't want folks to sweat over, oh my God, if I fumble here or there, it's going to affect my grade. It's not. Um, I want you to do your best effort and to put some creative effort into putting it together. But this is not a presentation class. So how you approach that is entirely up to you. If you want to have one person get up and give your group presentation, that's fine. That's perfectly fine. If you want to divide it up amongst yourselves, that's perfectly fine. The only thing I ask is that you be cognizant of time. Again, this is a 15 to 20 minute presentation. And so what I strongly urge you to do is rehearse the presentation once you're ready to go. And rehearse it in terms of how your slides are looking, and especially rehearse it in terms of timing. One of the things that can really happen a lot in presentations is that you think you've got 10 to 15 minutes worth of presentation, and you go off and do it, and next thing you know, 45 minutes have gone by. That's a very common problem, and that's an indication that you haven't rehearsed something. And don't think you can take your information and take, I find I have 45 minutes of presentation. I'm just going to talk twice as fast and fit it into 20 minutes. I had a student try and do that once. It doesn't work. So do your preparation accordingly. Now, in terms of the topic itself, now it sounds pretty daunting in terms of the material that's been placed there in terms of coming in and those kinds of problems. Those kinds of problems are more common than you might expect in organizations that are trying to deal with data, dealing with data from different places, getting it with different views and having it say different things and getting a handle on all of that. In the meantime, you've got real problems in the organization. This is a very common problem that a lot of folks have to be able to deal with. So I'll look forward to your work on that. So that's the group project. The next piece is a 5 to 7 page typewritten paper on a topic of your own choosing in analytics. So I ask that you give me the subject on this by the end of week 2, and your analysis should follow the same rigor as you did in the research project. Again, there are a number of topics in analytics, and I would just ask that you give me how you want to approach it. Here are some examples. Again, these are only examples. Analytics in healthcare providers or health insurance, generative AI and data governance, healthcare use of analytics by the general public, business analytics in retail, because there are some non-healthcare people in the course, applications of predictive analytics, how you might make use of that, machine learning, using analytics to identify issues such as patient safety incidents or hospital readmissions, and also topics on master and metadata management. So that is a sampling of the kind of topic areas. Now, so I ask you to give me your subject by the end of week 2, which is by next week. And in terms of the topic itself, first of all, I have yet to turn down somebody on a topic. I may have come back and said, "Are you sure? Are you that?" I may have suggested that something may be a bit ambitious for what they're trying to do, but I've never said to somebody, "No, you can't do something." I want you to get me something by the end of week 2, because this class is going to move quick. This is only a 7-week class, and so you just need to stay on top of things. And then the last piece we have is the online discussions. There are weekly discussion topics. You have just finished for the first week of them, and they're going to be carried into the discussion board each week. And I expect you to participate in these discussions. So I ask you to make at least one original substantive post and make 2 responses to somebody else's post. And again, your post should also reflect the kind of thoughtful scholarly research that I expect you to do in your research paper and your group project. So citations for work, staying on topic, and again, spelling, grammar, and scholarly tone. Just because it's an online, this may be an online discussion, but it's not Facebook. So keep your So again, be thorough and thoughtful in your presentations. And if your week one discussions are any indication, that's going to be reflected throughout, because your week one discussion submissions were quite good. So again, here is the schedule. I trying to condense this down into a single page, which I probably shouldn't have done. So again, we're dealing with data sources and data management in the first week. The second week, we're dealing with types of analytics, and that's also when I would like to see your research paper topic. The week three, we're talking about getting data into the right hands, talking about the different types of reports that are out there, and how you can deal with things like alert fatigue. Week four is analytics in healthcare and business use cases, and we continue that discussion in week five. And that's also when I would, at the end of week four, I'd like to see an outline for your research paper. At the end of week five, I'd like to see an outline for the group project. Again, the outlines are to be sure that you are on track, and if you're having any kind of issues, please let me know. So again, the idea is to stay ahead of this. Don't try and cram this whole thing into the last week. It's not going to be successful for you. Week six, we talk about data science and some of the issues there, and then that's when your research paper is due. And then week seven, we talk about ethical issues in analytics, and that's when the group project is due. And again, those presentations on October 22nd. So that is the housekeeping for the course itself. Let me go a little bit into some of the topics for the week. We're talking about data sources and management. So we'll talk about major sources of data and how that all works together. I'll go a little bit into the fundamentals of master data management and metadata management. We'll talk about the data lifecycle, and then we'll talk about data governance. So major sources of data. So within any organization, you have got multiple data sources that come in. You have enterprise data, which deals with all these different topics, whether it be architecture, strategy, data compliance, master data management, business intelligence, and then it goes on. Those have each of those pieces have different subtopics, and then that merges out within an entire organization, and you have a whole spider web of different interrelated data elements and uses for those data elements on your hands. And then you take that and then you spread it out across. Say you are a health system that is a part of a university system, then you are a piece in a much larger puzzle, and you can see how this spider web can really get very, very ungainly if it's not properly managed. So this is so getting into managing that, this is a kind of a simplification of what a data and analytics architecture would look like. So you have data sources which come into your systems. These may be an electronic health record system. It may be a claim system. It may be a CRM system. It may be data sources coming in from third parties. It may be streaming data. It could be video data from an operating room. It could be streaming data from a social media account where people are talking about your own health system. So all of this information has to be captured, and then then there's a piece where you are ingesting this data. This data is then passed through some type of a data warehouse or data lake, which deals with your information of different types. That data is then transformed and put into various analytic services that are being provided, whether it is machine learning applications or it is business intelligence reports and dashboards, self-service analytics, or any kind of real-time analytics that is out there. And then that deals with the various use cases, the various what am I going to do with this data now that I have it. So if I'm dealing with cases, I may want to know, or do I have patients that are at risk for a hospital infection? Do I have patients who are at risk for a fall? And I need to be prepared to spend extra time with them. So there's always so that is information that would be gleaned out of all these different data sources that are all coming in, and then that gets down to the individual person, whether it be a nurse on the floor, or whether it be a physician in his office, or dealing with a patient, or whether it be an administrator trying to prepare for a meeting with a hospital board of directors or a system board of directors. So one of the pieces of this is master data management, and this is how you can manage the pieces of that spider web and how you can get them to a point where you understand what is relating to what. It defines an accepted system of record across your diverse application systems, lines of business, and user communities. And this is how you get into the means of managing both your unstructured and structured data, your metadata, including your reference data, and your master data sets. So let's talk about the key components of master data management. This essentially gets at aligning data governance and organizational vision, and it is choosing a strategy that enables that vision, and it gets to a point where you are optimizing your data across its life cycle and delivering consistent data that has got uniform identifiers and attributes across the organization. So then you can deal with the different data. So some different data elements might mean different things in different situations. Effective master data management can help you get there. So, and now this is an example of when it failed. So you have a space mission in 1999. It was a Mars orbiter, and this was this was an international project where you had engineers putting together the systems and the computer systems and guidance systems on the spacecraft. Well, some of the engineers were making their landing calculations in English units, and some were making them in metric units. And as a result, the programs didn't know what to do with each other, and the spacecraft crashed in the Martian on the Martian surface. So that was a $193 million oopsie, if you will, and that was all because of a failure in a fundamental data management operation. So let's talk a little bit about, if you're an academic medical center, these are the kinds of data elements that you might be called upon to manage. You have enterprise code sets, you have customer relations data, you have claims and encounter management data, you have credentialing data if you're dealing with things such as physician qualifications and credentials, or if you're dealing with OPPE or the Joint Commission, or you may have domains that deal with consumer reporting or engagement. So if you're trying to put out information to the consumer who you may want to have come to you, all of these different domains are out there and need to be managed. So when we talk about master data and metadata, metadata is often the easier one to wrap your head around, because metadata is essentially the data about data. So metadata could be a table and could be a table and a field. So a table would be an address field. A field would be your first name, your last name, your street address, your zip code, your city, GPS coordinates, whatever else it might be. Those are all discrete data elements. That is metadata. Master data refers to the type of data that it is. So this is a great example of if you were to look at this sentence above. So this is creating something and expressing it in a real world scenario. So Jessica went to Dr. Harrison in Portsmouth on Thursday. He diagnosed her with hypertension and sent an office visit bill of $100 to her home address. Look at that sentence, extract every noun in that sentence. Every noun is a master data element. Jessica is a patient. She would have a first name who is in a patient lookup table. Dr. Harrison is a physician. He would have information in a physician table, whether it be his name, his practice information, his MPI ID, whatever else that is. Portsmouth is a facility for this health system. So Portsmouth is Portsmouth in Portsmouth, Rhode Island, let's say. It is a facility located there. That facility would have its own facility information. It would have its address information, which deals with Portsmouth, Rhode Island, as opposed to Portsmouth, New Hampshire. Thursday is a date that is contained in a date table. Many data warehouses have their own date table, which you can then take dates and you can roll them up, whether it be by day of week, or whether it be weekday versus weekend, or whether it be month, or whether it be quarter, or whether it be year, or whether it be fiscal year. Those can all be rolled up within a date table. Hypertension is a diagnosis, so that would be located within the diagnosis table. An office visit is a procedure that would be found in a procedure table. A home address is an address, which would be found in an address table. All of those nouns are master data elements, which would then translate into specific master data sources and have metadata associated with them. So let's look at Jessica a little bit. So let's say, for example, that she is. Let's shift this. Let's shift the location here. Let's say that this health system is actually in Massachusetts. Let's say we're talking about UMass Medical Center. I cite them because they're a relatively straightforward example. So Jessica was born in 1977. She got her BS from UMass Amherst in 1999. She has made yearly alumni donations. She received her MD from UMass Medical in 2007. She is an ENT specialist. She's been an ENT specialist at UMass Medical since 2009. She's been an assistant professor at UMass Medical since 2013. She was married in 2004. She has a postdoc from UMass Lowell in 2021. She has a daughter, Valerie, born in 2005, and is currently a student at UMass Dartmouth as of 2023. So Jessica is in the UMass system. So Jessica had a procedure done at this was a UMass facility. So she is a patient, a physician, an employee, a faculty member, a parent, an alumnus, and a donor all at the same time. And you have to be sure when you're referring to Jessica that you're referring to Jessica using the correct persona. And otherwise you can get things confused very, very quickly. So that's master data and metadata and how that kind of works together. I do want to talk very briefly about the data lifecycle. Data has a life cycle. It comes into an organization and it is used, it is managed, it is staged, it is put into its various locations, it is controlled, it is used by the user community, and then it is ultimately disposed of. So every data element has this kind of a life cycle. So data sources within say it's a hospital system. A data source could be a claims record. So it could be, say, an HL7 837 claims record. That is then loaded into a system. It is staged into a system and then put into an operational data store or a data warehouse or a data mart to be managing. Say you're managing revenue cycle or the like, and then it is monitored and controlled. So you have control protocols for who can access that data when. Claims data, if you dig deep enough, claims data can have PHI in it. So you have HIPAA issues. So that has to be monitored and controlled. Within that framework, people use and operate the data. And you may prepare reports on say you have claims for diabetes management, and you're looking to do a report on that, or you have claims that are for smoking cessation engagements, and you have STARS ratings that are tied to those. So you'll be using and operating that in a certain way. And then within any data source, there is a point where the data may be archived. So if this is, in this example, say this is data that is put into a reporting system and that is being used for a period of time. After a period of time, that data is really no longer necessary. So it may be archived. So it isn't necessarily, if you are doing trending on claims, you're probably not going to care about trending claims that happened 10, 15 years ago. You may want to access them at some point, but you're not going to be having them in a live reporting system for that period of time because it's not necessary. It's not valuable for the organization to do that. So the data will be archived. It is very rare that a system that the data like this would actually be deleted. Most hospitals have archiving policies, which essentially say that data is kept in a archive situation and can be retrieved within a certain amount of notice. That is mainly to support any potential litigation which may happen off of data. You say, for example, you have a case around, or you say you have a medical malpractice case, and there is a legal discovery around different things that were taking place with a certain patient case. You may be asked to pull claims data, or any kind of patient encounter encounter data, and that would be subject to that discovery. So that data has to be available in a certain way. And because sometimes these cases can go on for years, you still have to be able to access it in some way. So that data lifecycle governs how those pieces are put together. The next piece I want to talk about is data governance. Now, data governance is a critical function that's been taken more and more seriously in organizations as time has gone on, and it deals with creating the framework for how data is governed and managed and made available to an organization in a way that is predictable and that allows the organization to make most effective use of it. So data governance operates under an overall data strategy, and then is responsible for these major components here that are in blue on this diagram. Think of your data as a house. So the roof of your house is your strategy. The foundation is your information architecture and information infrastructure. And then within that, the rooms of the house are your metadata management, your data quality management, your enterprise data integration, your data security, your business intelligence and analytics, your content management, your third-party management. Any of those pieces, all those rooms in your house are being managed by data governance. And then there'll be more pieces on that later on in the course. So there is a video that you can access through Canvas. It's a YouTube video that talks about master data management and gives you that information in more detail. Although I think you've probably watched that video by this point. So that is the introduction to this course. Again, I want to apologize for the technical issues last evening, and we'll look to have the rest of the course go much more smoothly. I have also posted my cell phone number on Canvas. Please feel free to contact me using that if you have any issues. I often don't see my Salve email as quickly as I would like, and as quickly as I would like to be able to respond to any issues that you might have. So because this is also a 7-week course, you can't be waiting around for an answer if you have an issue. So please feel free to contact me in that way, and I'll work with you on any issues that you might have. If you're stuck on something, please say so. If you're trying to figure out something, please say so. My goal here is to help get you the information that you all need so as to be successful here. This is a topic that is very near and dear to me, and I hope that you'll get it. I hope that you'll get a lot out of this course. So again, I want to thank you all for listening to me, and I'll be seeing you online and wish you all the best. Thank you.